Greeting to our lecturer, Miss Nolinsa. So today, I, Elisa, will uh, present our project that I work together with Shazwan. Uh, our project, which is prenatal development pamphlet and poster. So I'm gonna present about the prenatal development. Uh, Prenatal development, which is also known as antenatal development, is a process of human development regarding the child's physical, cognitive, and psychological development that occurs in 40 weeks prior to the birth of a child that is heavily influenced by the regulation process of the genetics, which divides into multiple stages according to the age. So there are three stages of prenatal development, which is the germinal, which is start with germinal stage and continue to embryonic stage, and then finally the fetal stage. So the germinal stage is a development stage that occurs after fertilization when the sperm and the egg merge to form a new cell called zygote, which divides and multiplies rapidly through a process called mitosis for 2 weeks. As the cell divides, it will become specialized and form different organ and body parts necessary such as placenta, umbilical cord, and amniotic fluid to form the embryo, which marks the end of the first stage and goes into the embryonic stage. So the embryonic stage continues on for 8 weeks after the germinal stage. The embryo continues to divide and multiply cells to form important organs that we have now, such as the brain, kidney, bones, and by the end of it, the rest of the external and internal structure will form and turn into a fetus. This period of time also plays an important role where many fatal accidents may occur due to the genetics such as abortion when developing embryo and may also be influenced from exposures such as alcohol or radiation. So finally, the fetal stage. The fetal stage or the fetal development period where it lasts till birth or 7 months I'm sorry, throughout the fetal stage, the brain continues to grow and develop and also other further amazing changes such as putting on weight and preparing for life outside of the womb. So next we are going to explain about the prenatal care. Shazwan.
Sudah.
So uh, a key to protecting the health of the child is to visit the healthcare providers to get regular checkup appointments. Throughout her pregnancy, her healthcare provider will check the woman's weight and blood pressure while also checking the growth and development of her baby. For instance, by doing things like feeling your abdomen, listening for the fetal heartbeat starting during the second trimester, and measuring her belly. During the span of her pregnancy, she will also have prenatal tests including blood, urine, and cervical tests, and probably at least one ultrasound. If she is healthy and there are no complicating risk factors, most healthcare providers will want to see her in every 4 weeks until the 28th week of pregnancy, then every 2 weeks until 36 week, and finally once a week until delivery. Uh, Now we go to the nutrition and supplements. Now that she is eating for 2 or more, this is not the time to cut calories or go on a diet. In fact, it is just the opposite. She needs about 30 extra calories a day, especially later in her pregnancy when her baby grows quickly. If she is very thin, very active, or carrying multiples, she will need even more. But if she is overweight, her healthcare provider may advise her to consume fewer extra calories. Try to maintain a well-balanced diet that incorporates the dietary guidelines, including lean meats, fruits, vegetables, whole grain breads, and low-fat dairy products. By eating a healthy, balanced diet, she is more likely to get the nutrients she needs. But she will need more of the essential nutrients, especially calcium, iron, and folic acid, than she did before she became pregnant. Her health, I'm sorry, her healthcare provider will prescribe prenatal vitamins to be sure both she and her growing baby are getting enough. Last but not least, it is important to drink plenty of fluids, especially water, during pregnancy. A woman's blood volume increases dramatically during pregnancy, and drinking enough water each day can help prevent common problems such as dehydration and constipation. So next we're going to exercise. Uh, so the Department of Health and Human Services recommends at least 2 hours and 30 minutes of moderate intensity aerobic activity each week if she is not already highly active or doing vigorous intensity activity. Exercise during pregnancy has been shown to be very beneficial. Regular exercise can help to prevent excess weight gain, reduce pregnancy related problems like back pain, swelling, and constipation, improve sleep, and more of it. Whatever type of exercise she chooses, make sure to take lots of breaks and drink plenty of fluids. Slow down or stop if she gets short of breath or feel uncomfortable. If she has any questions about doing a sport or activity during her pregnancy, she should talk to her healthcare provider for more guidance in exercise. Next, we are going to the sleep. It is important to get enough sleep during her pregnancy. She will probably feel more tired than usual, and as her baby gets bigger, it will be harder to find a comfortable position when she is trying to sleep. Lying on her side with her knees bent is likely to be the most comfortable position as her pregnancy progresses. It also makes her heart's job easier because it keeps the baby's weight from putting pressure on the large blood vessels that carry blood to and from her heart and her feet and legs. Some doctors specifically recommend that pregnant women sleep on the left side because one of those big blood vessels is on the right side of your abdomen. Lying on her left side helps keep the uterus off of it. Ask what her healthcare provider recommends. In most cases, lying on either side should do the trick and help take some pressure off her back. For a more comfortable resting position either way, prop pillows between her legs, behind her back, and underneath her belly. Uh, Last is things to avoid during pregnancy. So when she is pregnant, what she do not put into her body or expose her body to is almost as important as what she does. Some things that really should avoid are alcohol. One of the most common known causes of mental and physical birth defects, alcohol can cause severe abnormalities in a developing fetus. Alcohol is easily passed along to the baby, who is less equipped to eliminate alcohol than the mother. That means an unborn baby tends to develop a high concentration of alcohol, which stays in the baby's system for longer periods than it would in the mother's. And moderate alcohol intake, as well as periodic binge drinking, can damage a baby's developed nervous system. Other than alcohol, pregnant women should also prevent taking drugs throughout her pregnancy. Pre- Pregnant women who use drugs may be placing their unborn babies at risk for premature birth, poor growth, birth defects, and behavior and learning problems. And their babies could also be born addicted to those drugs themselves. Nicotine needs to avoid in order to taking care of the baby during pregnancy. Pregnant women who smoke pass nicotine and carbon monoxide to their growing babies. The risks of this include prematurity, low birth weight, sudden infant death syndrome, asthma, and other respiratory problems in the child. Last but not least, caffeine should also avoid during pregnancy. High caffeine consumption has been linked to an increased risk of miscarriage, so it is probably wise to limit or even avoid caffeine altogether if she can. And remember that caffeine is not limited to coffee. Many teas, colas, and other soft drinks contain caffeine. Try switching to decaffeinated products, which may still have some caffeine but in much smaller amounts, or caffeine-free alternatives. So the next part will Shazwan present about our discussion.
So, the step we took when making the pamphlet and the poster. Before we start making the poster and the pamphlet, we decide to pick the color scheme that isn't too bright or mixed with brown to avoid the pregnant people that may read the product from feeling mixed emotion that may lead to nausea, vomit from specific color, as pregnant people will feel more emotional than usual and may have abnormal reaction to certain things. Then the font we use for the poster are Shrikan and Chewy to have the poster to make it look more cartoonish and comforting to be read by others. It also used to be to gain interaction from others to read this kind of font to make it look interesting and trendy. For the poster and pamphlet, we used Bluetooth lists to point out each point we used to tell the message about healthy well-being practice that pregnant people can do to make it easier for people to understand the information we relay much easier and cut to the chase of the topic without putting too much word in it. Furthermore, we added image that indicates pregnancy to make the cover page to let wanderers who see the cover page understand that the poster and pamphlet is related to pregnancy and healthcare. We also added Lumen Learning logo, the source of the research, to let the readers know where this knowledge is found and to be ensured that it is trustworthy and reliable for people to follow. And this is our product. On the left is our poster, and on the right is our pamphlet. So the next point is how to convince parents about the information from the pamphlet. So, while parents be convinced with the information from the pamphlet, we should first get rid of their suspicion by trying to find the information from a reliable source with the information backing up to ensure the claim of prenatal care. This is to ensure that the information is not putting the parents in danger and not at risk, getting rid of the suspicion or being seen as a conspiracy or fake information that is being spread around on the internet. Next, shows the benefit and the side effect of ignoring it to help the parents understand that the information is not joking around and play a crucial part in their life to ensure healthy birth may happen more often and lower the risk of endanger the life of the baby and the mother. Furthermore, using conventional words instead of complex words when explaining the step and procedure of the information helps the parents to understand the text easier and faster without risking misunderstanding or confusion when trying to process the information on the pamphlet. How important is it for all pregnant women to take care of their prenatal period? Prenatal care is essentially the health care you get while you are pregnant to ensure the risk goes lower by 3 times more likely than people who ignore the prenatal care that will put both mother and the child especially at risk of death or other terrible side effects. The next point is to keep in check with the health of the baby and the mother. It is because prenatal care can be done through getting checkup from doctors, nurses, or midwives when you see signs of yourself being pregnant until the end of the pregnancy to ensure a healthy baby being born and helping the mother to keep their health in check. Lastly will be to ensure future problems from happening, stop happening in the future. There are many things that could suddenly appear during pregnancy that can be controlled and will have a chance to make it into a critical moment whether it will endanger the child in the womb. Getting prenatal care early before you get pregnant is essentially important to let the doctors, nurse, or midwife check up on your health and current well-being to let them know steps to take to avoid future problems that might show up during the period of pregnancy and avoid high-risk pregnancies. Early treatment can prevent many future problems that may suddenly appear or may change the fate of an unhealthy baby into a healthy one. Now, I'll pass on to Melissa to talk about conclusion.
So, for conclusion, with increasingly sophisticated technology, the fetus has been studied and is considered to be an active agent in its own development. Many scientists believe that anything that affects the environment of the fetus can have an effect upon development beginning at conception and not at birth. Never before has the importance of prenatal care for the developing child has been so apparent, with increasing in research and knowledge of what factors can affect the zygote, embryo, and fetus. The likelihood that such factors can have a negative impact on the well-being of the child and the mother is greatly decreased. So that is our presentation for today. Thank you for listening and have a great day.